This presentation on rising costs affecting specialized surgery is by Chris Newcomb for Franklin University. Specialized surgeries, particularly those involving advanced grafts and highly trained surgeons, are inherently expensive. As the administrator noted, equipment and training often come from out of state or internationally. These costs can affect quality. The Iron Triangle model, cost, quality, and access, offers a framework for understanding the trade-offs that healthcare administrators must make to maintain an efficient, high-performing system. In the case of the vascular surgery department, the rising cost of healthcare significantly impacts all three components of this model, creating complex challenges for sustaining care, delivery, and financial stability. Specialized surgeries, particularly those involving advanced grafts and highly trained surgeons, are inherently expensive. As the administrator noted, these procedures often require equipment and training that must be sourced out of state or even internationally. These factors drive up costs significantly. To contain these expenses, administrators must implement meticulous resource management and financial planning. However, efforts to reduce costs can unintentionally limit access by delaying procedures due to supply chain disruptions or canceling operations due to budget constraints. Additionally, rising costs can compromise quality. When there is less money available for staff education or equipment upgrades, the organization risks falling behind on technological advancement. This not only affects clinical outcomes, but can also deter patients from choosing the hospital for their complex care needs. Mettenheike et al. Conducted a study with results showing partial support for the claim that cost-based incentives in purchasing prevent the selection of value-based options. It also helps explain why value-based purchasing, or VBP, appears difficult to implement in practice, especially given the increased outsourcing of healthcare purchasing to professional purchasers. This supports the conclusion that for VBP approaches to be successful, organizations need not just align incentives, but redesign criteria where cost is given lower priority relative to value and quality. Maintaining quality in a cost-restricted environment is perhaps the most pressing challenge. The vascular department has implemented several innovative strategies, such as utilizing enhanced recovery after surgery, or EARS, protocols, and robotic-assisted surgeries, which have been shown to reduce hospital stays, improve outcomes, and lower complications. These practices simultaneously address quality and cost concerns, demonstrating that strategic innovation can shift the balance positively within the Iron Triangle. Kaimi et al. Found that the incidence of surgical site infection after robot-assisted radical cystectomy was significantly lower than that after the open procedure. However, decreased bleeding volume, which was significantly associated with robot-assisted procedures, was an independent and more significant factor for reducing surgical site infection after radical cystectomy than the differences of the surgical procedure even after propensity score matching. The issue of access becomes increasingly relevant when considering patients from underrepresented or rural communities who need specialized vascular surgeries. Travel, cost, and scheduling barriers may limit their ability to receive timely care. Delays due to supply chain issues or surgery cancellations can discourage patients from rescheduling, ultimately reducing the department's reach and the organization's perceived reliability. Telehealth and hybrid work models have helped bridge some access gaps, particularly for pre- and post-operative consultations. Yet these solutions require digital infrastructure and patient adaptability, which not all communities have equal access to, creating another form of disparity. Several conditions exacerbate the tension within the iron triangle in this scenario. Post-COVID financial recovery. Hospitals are still dealing with the financial strain from the pandemic, limiting flexibility and budgeting for new equipment and training. Supply chain distributions. Delayed shipments of essential surgical materials directly affect scheduling, access, and the perception of care reliability. Labor market challenges. Recruiting and retaining highly trained surgical staff adds significant cost and logistical complexity. Regulatory burdens. Compliance with changing healthcare regulations, billing codes, and insurance limitations further strains administrative and financial resources. These factors interact in a way that requires constant reassessment and prioritization. Enhancing one point of the triangle, such as equality through investment in robotic surgery, may initially increase costs, but may also reduce length of stay and readmission rates, resulting in long-term savings and improved access. In conclusion, the Iron Triangle model helps illuminate the inherent trade-offs faced by healthcare leaders. Rising healthcare costs threaten both access and quality, especially in departments providing highly specialized procedures. The administrator's role, therefore, involves not only managing the department's operations, but also making strategic decisions that support all 3 points of the triangle as effectively as possible. Innovative care models, data-driven decision-making, and cross-departmental collaboration are essential tools for achieving that balance. Understanding and applying this model equips leaders in healthcare to navigate complexity while striving for excellence and equity.